Hi everyone, this is Sarah. I'm the nurse from the Bay Area. I work at a local hospital and I'm the one that was producing masks during COVID. And I'm sending this today because I'm very concerned. I'm concerned about the dismally low rates of vaccination in this country, not only in our state, but throughout the U.S. We're averaging a vaccination rate of about 49.5%. That means less than 50% of our entire population has been fully vaccinated against COVID. And I feel it's time for me to speak up about this sensitive and essential topic. So if you are part of the 50.5% of people that have not been vaccinated, I am speaking to you, and I'm enlisting you to help me understand, because I'm very confused, and I'm also curious. We can all do whatever we decide to with our bodies, and we all have, our own belief systems, and I don't want to challenge your belief system. I just want you to help me understand. So recently, this is what I've heard so far as to the reasons that people are not getting vaccinated. Number one, I'm healthy and I have no predisposing illnesses or immune system issues that would make me susceptible to getting very sick with COVID. Regardless of your health status, about 14 to 16% of all people who get COVID are likely to get a severe inflammation effect on their lungs. As their lungs swell, they fill with fluid and debris that can have long-lasting effects, sometimes requiring artificial airways, ventilation, and death. It also predisposes you to pneumonia. This is where the air sacs of the lungs fill with fluid, mucus, and other cells that are trying to fight the infection. Either of these cases can lead to respiratory distress, failure, and death. Second, I don't think the vaccine has been tested enough. I don't want to take the chance of getting the side effects I've been hearing about on the news. My answer to this is millions upon millions of people have received this vaccine under the most intense safety and scrutiny monitoring system in the U.S. history, according to the CDC. Their VEERS project, it's the Vaccine Effects Monitoring System, has an opportunity for people to immediately report any signs or symptoms they're having after receiving the vaccine. And this information is uploaded into a database and goes into the research on the vaccine. And the reality is that only 5 out of 1 million shots have received any kind of symptom like anaphylaxis. This is a general swelling. It also can lead to shock. And 39 and 13 million shots have received some kind of thrombotic event, that is a clotting system, or thrombocytopenia. This is a disorder of the blood levels. These are extremely, extremely low incidences. You have about 1,000 times higher likelihood of getting hit by a car. And I think you get the picture, and I don't have to go through each of these effects. The third thing that I'm hearing is that I want to see longer-term studies to prove its efficacy and safety. And in my mind, this is equal to you saying that it's okay for everyone else that gets the vaccine to take the risk and to provide this long-term information so that you personally can feel safer and more confident in getting the vaccine yourself. This is basically saying that everyone else can be your guinea pig. I personally am very uncomfortable with this concept. This is why I put myself at the front of the line when I was first eligible to get the vaccine. And I also deeply, deeply trust its safety and efficacy. And at this point, I'm going to ask you to think about family members or people in your community, the elderly and the young people. The Delta variant has proven to be able to cross over and affect children. That means that if you don't get vaccinated, you are a potential carrier to these individuals in your community. These are children. Also, the undereducated. There's a lot of people that don't have the education on the vaccine that you might have. And what a powerful effect and impact you could make if you decided to get the vaccine and were able to educate those that don't have the opportunity to receive education. Lastly, I invite you to spend a day in our ICU as COVID starts to ramp up again. 90% of hospitalized cases are of the unvaccinated. I would like you to watch the people that are succumbing to the effects of COVID take their last breaths that they can take on their own and then have to rely on artificial respiration, intubation, and potentially death. I personally do not want to see this happen again in our hospitals, so I'm enlisting your support to help me understand. Please IM me, or I enlist you to email me, sarahmontague@mac.com. Let me know your reasons for not getting the vaccine so that I can better understand. And again, I won't try to talk you out of it. I just want to enter into a healthy discussion because I'm really curious. Thank you so much for listening today. Please get your shot. And if you're not sure about the information that you're seeing on social media, please don't share it. Thank you.